Many Minnesotans, even those not facing steep insurance premium increases this year, express anxiety about our healthcare system. Both parties are now calling for a special session to provide specific relief to Minnesotans who buy insurance on the individual market, but who do not qualify for subsidies. Joining me in the studio to provide a Senate Republican perspective on this crisis is Senator Jim Abeler. Welcome.
Thanks for having me.
So the whole point of insurance is to spread the risk.
Right.
And the individual market that we're talking about is 5%. Isn't that too small of a group to sufficiently spread risk?
Absolutely, and it used to be much larger, and we used to have a separate program called MCHA, which took care of the high risk, the high cost people who were very ill. And the people with the more normal amount of illness were in the side group. And now as this pool has gone away and the market has shrunk down, they're all landing in this small pool, and the rates are exploding.
Mm-hmm. And what would you propose to do about this?
Well, I'm trying to stay on the policy of this, but there was a federal change and then some ways that we implemented the Affordable Care Act, Obamacare, and a lot of us thought it was a bad idea, and we were very concerned that this very thing would happen now. Mm-hmm. And so the big companies, the big insurance companies, big pharma, all were carved out, and all was left was the people in the small market that is now being crushed by mm-hmm. just bad cooperation and bad implementation. And so you have to kind of go back a little bit and make things how they were. And so we need a way to take care of these high-cost individuals so they can get properly cared for, but not at the expense of a regular farmer or a Main Street hardware store owner.
Right.
And that has not happened, and now we have the crisis of rates going up 50 to 67%. Yeah. And it's making some of these folks functionally poor. And they used to be middle class. Like, mm-hmm. what happened?
Mm-hmm. And you made the point recently that these are your neighbors and small business people that are really experiencing these double-digit increases. In addition, we've heard some testimony of these individuals and how their access to doctors is decreasing, and it's harder to get specialists. They're just running into problems with access to their health care. In addition, there's caps now. So what would you propose to do to kind of address some of this problem?
Well, there's two parts, and in the time we have, it's so short, but I'm mm-hmm. really glad to take work at the tip of the iceberg here. Mm-hmm. There aren't enough plans. Minnesota has regulated the health industry so tightly that many have left over the years, and now we only have a handful of HMOs that cover. Mm-hmm. Hardly any of the regular insurance companies are here anymore. And so we've lost a lot of choice. And so that was kind of good. It made sense at the time. There were 8, and then now there's functionally about 3. And so now it's much more of a monopoly market, and there's not the competition there was. Farmers can't join into a group of farmers and buy their own insurance. The hardware store owners couldn't make a hardware association plan. Well, why not? You can't buy something from Iowa that you happen to like because it's been all constrained. So there's no competition. And also then, they've limited these networks to very few doctors. I have talked about this my entire time I've been in office, 17 years, mm-hmm. that the only way you save money by limiting doctors is by denying proper care. Mm-hmm. And so the doctors, in their latest iterations, people can't go to the doctor they've gone to forever. Right. The original promise was, you can keep your doctor, keep your plan, and it's going to be cheaper. Mm-hmm. None of those came true. And on the doctor part, you had to get a new doctor last time, and okay, I guess we know him too. The third one might be 30 miles away and never met him. Mm-hmm. And the premiums are maybe $20,000, $25,000 mm-hmm. for a $10,000 or more deductible. Mm-hmm. So you're looking at $30,000, $35,000 just to get in to start paying for it. This is catastrophic for these families, and that's why a lot of us are so concerned.
So, I mean, you've said that people should be able to create some co-ops or some other groups. Any other ideas for how we can help these people get access to healthcare, good access to healthcare?
Right. On the heart of this is this very complicated reinsurance. Okay. And so let's say I have some multiple sclerosis or something. I need a lot of care, mm-hmm. maybe $300,000 a year, mm-hmm. and the average person needs much less than $100,000. Mm-hmm. And so the old MCHA plan, which is an acronym that doesn't matter today, but this high-risk pool would have borne the extra cost of that. And we shared those amongst all the people that bought insurance. Mm-hmm. $168 million worth when it was last used. Mm-hmm. And that took a lot of the bite out of these high costs. Mm-hmm. And so maybe the insurance company would pay the first 100 and the second 200,000 would be paid for by another pool. That's reinsurance. And that way, the people who have normal amounts of illness and the people who are kind of sick, the rates stay affordable, which is sharing the risk, but not the highest risk. And that's where this has fallen apart. That's the complicated but really important thing to fix, this reinsurance.
Some Republicans are talking about eliminating MNsure and moving to the federal exchange. What is your position on that?
I've always liked the Minnesota version. I like things kept to home, and you know, the feds, God bless the feds, but they're in Washington and they're so smart, they're too smart for us. I think still that we should try to rescue what we can out of the MNsure. It's only a place to buy a product. And so if you have a small pharmacy in Owatonna that's a locally owned one, or Walgreens or CVS, they still sell the same toilet paper and pharmaceuticals. So the products aren't going to change, it's just how they organize it. And MNsure has been a mess. And it could have been so much easier to use, and it still is clumsy. And there's improvements we can make. But I would like to make them on our terms. And frankly, I would like to make them in a bipartisan way. I have tried since the beginning of MNsure and the Affordable Care Act to work with people on the policy about this, to make it functional. And frankly, the one side has been dismissive. And a lot of us who meant to make it work better, because we live in the same towns they do, and we've been dismissed. And so a lot of us said, this is going to happen. Oh no, it's going to be amazing. It's going to be like Expedia. And it wasn't. And so it's time now for us to stop the politicizing. Stop it, just stop. Because your neighbors are getting crushed, and they're facing financial ruin, and they're facing becoming functionally poor while being a member of the middle class. And I think that is like not anything anybody wants to happen to them.
Senator Abeler, we're going to have to come back to this another time, but thank you so much for coming in today.
Thanks for having me.